Hey guys, Dr. Chandler Mann here. I'm here in my treatment room with my patient. We're going to be applying a RevoShield amniotic membrane to the patient's eye today. After evaluating our patient, what we saw with corneal sensitivity testing and fluorescein staining is that she does indeed have neurotrophic keratitis with corneal inflammation called keratitis. Today we're going to be using the RevoShield amniotic disc to combat the inflammation in the cornea. When we're using a dehydrated amniotic membrane, we typically want to apply it with a bandaged contact lens to the patient's eye to ensure that the amniotic membrane stays in place exactly where we want it to and is absorbed fully through the cornea to heal the cornea from the inflammation and keratitis present. When we're using a RevoShield amniotic disc, what we want to do is make sure that we have our allograft ID right here present. We want to make sure that we have the expiration date. It's an active, safe, and effective disc to be using. So we'll open the membrane right here. When we take the membrane out, the first thing we'll receive is our stickies that we can place on the patient chart. That's what I personally do. I place 2 of them on the patient chart to be scanned into the patient's chart. The allograft ID should match the allograft ID seen on the package right here. That confirms that that's the correct membrane that we're using today. Secondly, we'll be pulling out the actual amniotic disc itself. As we can see, we're using an 8mm RevoShield amniotic disc. Allograft ID matches the allograft ID seen on the sticky notes and the allograft ID that is on the initial packaging. When we're going to open the amniotic disc, we open it here. It is double layered for safety and protection. The smaller packaging has the amniotic disc right in here. What we're going to do is open our amniotic disc softly. Now we have the amniotic disc. I'm going to lay it down right here. I have these speculums to use the amniotic disc to place inside the bandaged contact lens, ensure that it's centered, and then be able to apply it to the cornea. When practitioners are applying this to the cornea, they can do it one of 2 ways. I personally place it in the contact lens initially, lay the patient back in the chair, and place that contact lens directly on the eye. Other practitioners can use a lid speculum, lay the patient down, prop the eyelid open, dehydrate the cornea with a Wexel sponge, lay the amniotic disc directly on top of the cornea or on top of the affected area of the cornea, and then place that bandaged lens on top of the cornea to secure the amniotic disc. Either way is perfectly fine. It's whatever you're most comfortable with and whatever your patient is most comfortable with. After cleaning your hands, you can then take the contact lens, apply the amniotic disc directly into it, and have the patient ready for setup. So I'm going to take the bandaged contact lens right here. I'll be using my forceps to grab the amniotic disc. I'm going to place it directly in the center of the contact lens. It's difficult to see, but the amniotic disc is clear and centered. Easy application into the contact lens. I'm then going to lean my patient back. I have my patients look down first, pull their upper lid, look straight ahead, apply the membrane directly to the center of the cornea. Blink, blink, close your eyes. After application, what I will do is take my slit lamp, evaluate the patient's cornea, ensure that the membrane is directly centered and the contact lens is fitting properly. If that's the case, I will send the patient home with our post-operative instructions. Typically, I provide or prescribe a prophylactic antibiotic to use 3 times a day while the bandaged lens is in the patient's eye. I'll then see her back in 48 hours to ensure that the amniotic membrane has completely absorbed into the cornea, remove the bandaged contact lens, ensure the cornea is clear and another application does not need to be done, and then send the patient on her way with a happy, healthy cornea.